Homeopathic medicines to treat enlarged adenoids. Homeopathic medicines that work wonders in treating enlarged adenoids include Agraphis Nutans, Baryta Carb, Calcarea Carb, Sambucus, Ammonium Carb, Sulphuricum, Nux Vomica and Tuberculinum. 1. Agraphis Nutans, top-grade medicine. Agraphis Nutans is one of the best homeopathic medicines for treating enlarged adenoids. It is a natural medicine prepared from plant Bluebell, also known as wild hyacinth. This medicine is mainly prescribed based on its two important indications. First is nasal blockage due to enlarged adenoids, where it proves very effective. Next is ear complaints, mainly deafness, resulting from adenoids growing big in size. Apart from these, Agraphis Nutans is also very effective when enlargement of adenoids and tonsils is present together at the same time. When and how to use Agraphis Nutans. Agraphis Nutans can be given in any case of enlarged adenoids once diagnosis is confirmed. It will help in managing nasal blockage, which is the foremost complaint a child faces from enlarged adenoids. Side by side, it will help in shrinking the size of the adenoids. Also, never forget its use for ear complaints, especially deafness resulting from enlarged adenoids. A child having enlarged adenoids can be given this medicine twice or thrice a day as per the intensity of the complaint. 2. Baryta Carb, for managing recurrent tendency to get cold and sore throat. Baryta Carb is a homeopathic medicine of great help in treating numerous health concerns in kids, among which enlarged adenoids is a prominent one. It is mainly prescribed where a child has tendency to have colds and recurrent throat infections. Both adenoids and tonsils may have enlarged together simultaneously. In acute phase of URTI, upper respiratory tract infection, pain in the throat on swallowing, sneezing, and thick yellow nasal discharge may also be seen. The mouth gives off an offensive odor. The child may be physically inactive and sluggish. When and how to use Baryta Carb. Baryta Carb is considered in cases where the tendency to have recurrent cold and sore throat is present. This medicine can also be used when adenoids and tonsils, both are enlarged. Its use is recommended in the phase when acute URTI has not set in. This medicine will help build up immunity to prevent frequent infections. Its use can be done from low, like 30 C, to high potencies, like 200 C and 1 M, but not in very frequent doses. To begin with, one can take Baryta Carb 30 C twice a week only. To increase dose or potency, kindly consult a homeopathic doctor. 3. Calcarea Carb, to manage disposition to take cold easily. Calcarea Carb is the topmost medicine for kids who are highly susceptible to cold and fall sick after every such exposure. They get repetitive cold with clear watery nasal discharge or yellow foul discharge. Besides, nasal blockage is very prominent, which is the most troublesome at night. The chronic tendency to infections results in enlarged adenoids or tonsils. Such children also tend to perspire excessively on the scalp. When and how to use Calcarea Carb. Calcarea Carb is used in kids who are inclined to get recurrent colds from even slight exposure to cold weather. Like Baryta Carb, this medicine is also used when no active infection is present to strengthen a child's immunity, making him or her less prone to catching cold frequently. Its use varies from low, 30 C, to high potencies, 200 C, 1 M, varying from case to case. Initially, Calcarea Carb 30 C can be given twice a week or 200 C be given once a week. For changing its dose or moving to higher potencies, advice from homeopathic expert is a must. 4. Sambucus, to relieve nasal blockage. Sambucus is a natural remedy sourced from plant Sambucus nigra, commonly known as elder. Its use is highly considered to manage blocked nose at night with thick mucus in nostrils. The mucus is also very sticky. Mouth breathing due to a blocked nose is pronounced. When and how to use Sambucus. This medicine is best to relieve nasal blockage in kids. This medicine acts for a short period of time and bears repetition well. Sambucus 30 C can be used 2 or 3 times a day as per severity of the problem. 5. Ammonium Carb, for intense nasal blockage. Ammonium Carb is a very suitable medicine to manage nasal blockage. The blockage is intense, causing the child to breathe through mouth. The child may jerk several times during sleep due to obstructed breathing. When and how to use ammonium carb. Ammonium carb can be given when there is nasal blockage along with mouth breathing. Ammonium carb 30 c given 3 times a day gives great relief in nasal blockage.